Hello, my name is Dr. Harb with Urological Associates in Davenport in the Quad Cities, and I would like to talk to you about BPH and new advanced treatment options for prostate enlargement. Why is it important? We're going to talk about the importance of the prostate. We're going to talk about benign prostatic hypertrophy, how we diagnose it, and what treatment options we have. We also will discuss the UroLift system procedure today. So if you think about the prostate, a walnut-sized gland that sits under the bladder, and it has the shape of a donut. So there's a tube inside the prostate that allows the urine to pass through, and it surrounds the prostate, that surrounds the urethra. And basically, that channel sometimes can be blocked with enlarged prostate. It's basically like urinating through a tube, through a straw. And the tighter it gets, the more difficult it becomes to urinate. So, the importance of prostate, it produces and transport sperms during ejaculation. And we have many conditions that can affect the prostate. Sometimes we see prostate infection, which is swelling inflammation of the prostate. Very common is to have enlarged prostate, and sometimes they call it BPH. Basically, it's a benign, non-cancerous enlargement of the prostate. And then we have prostate cancer. It's very important when we see patients to make sure they don't have prostate cancer. So the prostate grows with aging. It's every man will have enlarged prostate, and as they age, the prostate will grow with that. And there's a simple way of finding how big or how many patients are affected with enlargement of the prostate. Usually it's about 50, the age plus 10%. If you're 50 years old, 60% of the patient will have BPH. If you're 70 years old, I would say 80% of the patients will have BPH. So most men at some point in their life will develop a benign enlargement of the prostate. So why is it important? It is important because it affects the quality of life. We always want to make sure that we identify this is a non-cancerous enlargement of the prostate. We want to make sure the patient does not have prostate cancer. So we always check the prostate, and with digital rectal examination, we also check for PSA. That's very important for patients with family history of prostate cancer. Every man above the age of 50, we always try our best to find out if they have prostate cancer or not as a first step. So if you look at the prostate, as the prostate enlarges, it goes pressure. Again, that channel or the curtains closes down, and that can cause problems. And sometimes we see that channel is so narrow that it can affect your kidney function and cause damage to your bladder. We frequently, unfortunately, see patients who come at late stages with bladder failure, and that can affect their kidney function. And a lot of time, these patients will require many months of treatment before they're able to urinate. So it's important to find out and treat these issues before they cause permanent damage to the bladder. So what do we do to find out if these patients have BPH or not? We look at several questions. We ask the patient if they have frequency, if they have the urge to go, if it's difficult or painful to urinate, weakness of the stream. And we have 7 questions, and each question is graded from 1 to 5. And it's called the IPPS score, and that is a simple way of telling how the patients are doing. And this is a simple way of telling if these patients require something to be done soon or not. But many patients who have BPH have other issues, and it affects their quality of life. It disrupts their sleeping pattern. It also affects their wife's quality of life, because the wife usually doesn't complain, but when the husband goes 4 or 5 times a night to urinate, they're awake and they wake up and it's difficult for them to go and sleep. It disrupts their activities. These patients know every rest area when they're driving somewhere. and they basically map every bathroom in the city. They know where it is. So when we look into the bladder, we want to evaluate how is the bladder. Is it normal? Is there any scar tissue in the bladder, or there's bladder failure? And when we do cystoscopy, which is basically a camera that we put in the bladder, we can tell if the patients are having significant problems. If you look at the picture on the left, this is a normal bladder. It should look smooth, pink, and nice. If you look in the middle picture, we can see some scar tissue developing, and on the right side, you can see significant scarring or stretch marks in the bladder because the bladder has been stretched for a long time, and that can lead to bladder failure. So once we diagnose BPH, we ask these patients about their medical history. We make sure there's no diabetes, there's no other health issues, and we ask them how much does it bother them. Whether we move to the next step of diagnosing these patients, there's multiple non-invasive tests we can do to find out if they do have enlarged prostate. The most simple way is to have a prostate exam with a finger. We do a bladder scan to make sure the patient does not retain any urine. It's a simple, non-invasive, non-painful way of finding if the patient is retaining. A lot of patients can retain a lot of urine without even knowing, more so the diabetic patients because their sensation has been decreased. We do a non-invasive studies where we evaluate if the patient has bladder dysfunction. It's non-invasive, so the patient will come in with a full bladder, and we have a special computerized system that will measure their pressure and will tell us if these patients will need something to be done. We also have non-invasive way of testing to see if these patients will benefit from UroLift or not. But in order to do that, we need to look into the bladder to make sure there's no bladder tumor, to check on the prostate size, shape, and we also do an ultrasound, and the ultrasound will tell us the shape of the prostate, the size of the prostate, because UroLift has specific recommendations of what size prostate can be done. And what shape of the prostate is important because we want to predict before we do the procedure if this procedure is going to work out or not. So this is the IPPS score that I mentioned earlier, 7 questions, and each question has answer from 0 to 5, and we add these numbers, and then you can have 0 to 7 is mild, moderate from 8 to 19, and severe symptoms from 20 to 35. Based on our experience, we see most of our patients have severe symptoms. These patients present in late stages, but however, we can still help them. Most men do not complain unless the wife tells them to go ahead and get checked. But the issue is if you have severe symptoms, that can lead to bladder failure, that can lead to indwelling catheter where you have to live with a catheter, and it's an issue. It's a big issue for men to have a catheter. So what treatment options? Watchful waiting is okay for patients with mild symptoms. When we have the score is under 7, we can most of these patients will be stable. Some will improve, some will get worse. But in general, we don't tend to be aggressive with mild symptoms. Patients do very well. A second option is medication for patients with mild to moderate symptoms. Medications, that means a lot of time it's a commitment for life. And that means you have to take the pill the rest of your life, and most of the time. There's 2 classes of pills. There's a pill to relax the prostate, and there's a pill to shrink the prostate. And these have side effects. Sometimes they can cause dizziness. Sometimes they can cause you to be tired, and sexual dysfunction is common with these pills. Sometimes ejaculation problems, sometimes actually erectile dysfunction. So these pills have some side effects. So for young people, I mean, they do not want to have these side effects, and they don't want to commit to medications the rest of your life. UroLift is a minimally invasive procedure. and I'm going to explain to you the UroLift procedure. Certainly, there's more aggressive ways of taking the prostate, including laser surgery, and if the prostate is massively enlarged, robotic prostatectomy is done. Basically, it's done in a hospital setting where the patient has to be admitted and taken care of in a hospital setting. So if you look at the potential treatment options, there's many treatment options, but we look at what the system can give us, what kind of improvement we can have, and we can tell that UroLift has required minimal complications after. These patients will preserve their sexual function, although with other procedures, with the traditional rotor-rotor job, which is called TURP, patients can develop erectile dysfunction, but medical therapy can cause that. So if you look at the UroLift system, which is in the middle here, you can tell that there's minimal complications and side effects with this system. So if you just a simple way of looking at UroLift, you can see the first picture enlarged prostate. The second step, if the patient qualifies for UroLift, certainly when we give the patient the option of taking nitrous oxide. The procedure is done in the office setting, in I would say 99% of the time, and that's very good because a lot of patients do not want anesthesia. If you need anesthesia, you have to have a cardiac workup, and you have to jump through many hoops to get that done. This is done in office setting, minimally invasive. We offer the patient a low dose of Valium to have him relax, and I would say most of the patients like that. We also offer nitrous oxide, which is basically a gas to make them even more comfortable with the procedure. And it's done in an office setting where you walk into the office and you walk out of the office. So if you look at the UroLift device, it's a small, tiny device, and I have it in my hand here actually. You can see it here. It's a small device that is implanted in the prostate. We use between 4 and 6 implants. It really depends on the shape and size of the prostate, how many implants we put in, but we visually see the results of UroLift immediately. When we put the implant, we can see that the prostate is opening up. It's like closed curtains, and now they're open, and we can see the results immediately, which is very helpful. So this is a illustration of a picture showing the before and after, and actually most of our patients can watch the procedure while we're doing it on the video camera. We can both see the same picture, and a lot of time we can see them, show them before and after, and they can see the results instantly when we're doing it. So what is the next step? If anybody is interested in UroLift or have more questions, I'll be more than happy to discuss UroLift with anybody who has interest. So before we leave, I would like to talk to you about our Center of Excellence. In order to become a Center of Excellence requires a lot of expertise in UroLift, not just volume of procedure, but outcomes. We monitor patients' outcome, and we make sure these patients are optimized to get the best results for UroLift. We have achieved the Center of Excellence. We're very proud of that. And if you have any questions, please do not hesitate to call. We would love to see you in our office. Our phone number is 563-359-1641. And I really thank you for being with us here. Thank you.